Hey, my name is Megan Davis. I'm a nurse practitioner student at Henderson State University, and today I'm going to show you how to do a simple interrupted suture. These are individual sutures that are at regular intervals along the wound. These are usually used for small wounds or lacerations on the epidermis. A lot of times these are on arms, face. Sutures that are good for these are 4-0 nylon monofilaments, and these are great because they are non-absorbable, but today I'm going to be using a 3-0 nylon suture. I also have with me my skin pad that I'll be suturing. I have my forceps, my scissors, and my needle holders. Okay, doing the suture, I would have some sterile gloves on. Before I would start, I would clean my wound, assess the wound, make sure it wasn't too deep for just an interrupted suture. I would also assess the patient. Would they need injected with some lidocaine? And then I would get started. So I'm going to start out by opening my suture, and then I'm going to note the suture right here. And when I grab my suture, at the end of the suture, it's a little, like it's got a little bevel here at the end, and then I'm going to grab it like right at the beginning of that bevel with my needle holders. So the way I'm gonna hold these is I have my thumb in one side, and then I have my fourth finger. So then I use my pointer finger to stabilize as I grab, and it gives me more stability. So then I'm going to just grab my needle, lock, and pull. Okay, and then I'm gonna just put that down. Adjust mine. So then I'm going to, I have my forceps here, and I'm going to always use my forceps to hold and grab the patient's skin. So when I grab the patient's skin, I'm going to adjust my wrist so that my needle is going into my patient's skin at a 90-degree angle. So I'm going to start out at one end of the wound. And at a 90-degree angle, oh, you can see this, insert my needle through. So at this point, there's two different ways you can do it. You can bring your needle all the way through the wound, and then like bring it up through the wound or the middle of your laceration, and then reinsert through the next side of your laceration. But for this video, I'm going to grab the other side of my laceration, and I'm going to go all the way through, and then I'm going to let go, and never grab your needle from the tip because it could break off. So I'm going to push the back side of my, still holding the side of my laceration. I'm going to push through, and then I'm going to grab the middle of my needle and pull all the way through. Okay, and I'm going to drop my forceps here and my needle, and this is where I'm going to start my stitch. I'm going to, again, I have not let go of my needle holders. I'm going to take, and I mean, it's preference because I'm right-handed. So with my left hand, I have a hold of my suture, With my right hand, I'm going to go over with my left towards the camera 2 times. And then I'm going to grab the end of my suture and I'm going to pull through. And I want to make sure that my suture line is flat, like so. See if I can, I don't know if it'll show you. You don't want it to look knotted. You want it to be a flat, and you want to do the 2 knots or a doctor's knot. So since I went towards the camera, this time I'm going to go towards me 1 time. And that 2 throws equals 1 knot. You want to make sure that when you are doing the interrupted sutures, you do an even number of throws, because if you do an odd number of throws, you don't have equal knots, and then your suture is not stable and it has a risk of coming undone. So for this suture, I have 1 knot completed. So I'm going to go back towards the camera and do another throw back towards me. So I have officially 4 throws. So I have 2 knots, and I'm going to go ahead and cut my excess. And then I'm going to do another. Again, starting with the double throw doctor's knot. And you want to make sure it's a flat knot. And then another throw the opposite way. And then another throw. And another throw. And then with 4 throws on this one, I'm going to cut. When I was prepping for this video, since I work in surgery, I had a couple of the first assist kind of walk me through their processes and kind of their techniques in suturing, and they were, and I had got lots of helpful hints and tips, and with the interrupted suturing and how many knots depends on location. You know, if you're gonna be in bigger tissue, you know, you're gonna do more knots, more throws. Whereas if you were suturing on the face or like a small laceration on the arm, you're not gonna have to do as many knots. So I did my 2 little sutures. You want to make sure your sutures are not right on top of the laceration, or you want to move them over to the side of the wound. If they are right on top, it messes with the wound healing and the scar formation. Especially when someone comes in with a cut on their face, you know, the most important thing for them is what is the scar going to look like on their face when it heals. After you do the stitches and the wound is healed from end to end, the edges meet all the way down, you know you've put in enough stitches. You can dress it many ways, a band-aid, you can do gauze, 4x4s, really it's provider preference on how you dress the wound and the stitches, but a Band-Aid will do. And then removing the sutures. Most of the time, face sutures can be removed in 3 to 5 days. Scalp is 7 to 10 days. Limb sutures are 10 to 14 days, and trunk is 7 to 10 days. For that, you want to just grab your suture at the top and which I got these a little tight. Top of the knot, and cut right underneath it, and then pull it out. And that is my interrupted suture video. Thank you.